Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mom?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
I really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it. Stop CPR. He's got a pulse.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
On this episode of Paramedics, a father's worst nightmare.
I saw the car hit Kevin. My immediate thought was death.
And now, flight paramedic Steve must get the 19-year-old bike accident patient to hospital fast.
How's my leg look?
He could actually lose his leg, and that would be just absolutely life-shattering for him.
Intensive care paramedic Matt performs a difficult procedure to alleviate his elderly patient's excruciating pain.
Sorry, Cal.
As I push the needle into it, there's a big area of air, which is a clear indication that his lung has collapsed by getting lots of bubbles out.
What do you think that looks like?
And little Bella is won over by dad and daughter team, Brett and Teagan.
Yes!
Emergency services. Okay, tell me exactly what happened.
My husband had a fall.
Okay, how old is he?
85.
And what part of the body was injured?
Look, I think it's his ribs.
Okay, is he having any difficulty breathing?
Yes, but he's got emphysema and lung cancer.
Okay, an ambulance is on its way.
A Code 1 dispatch for an elderly man with potentially cracked ribs from a fall immediately has mobile intensive care paramedic Matt concerned.
When a patient has a lot of pre-existing medical conditions, people perhaps don't tolerate other injuries as a healthy person would because of all those conditions.
Another ambulance crew has arrived minutes before Matt.
Hello there. My name's Matt. Is it your dad?
Yeah.
Yeah, how's he going?
Looks pretty grim, to be honest.
Okay. Does Dad live here alone or?
No, he lives with my mum.
Okay.
So he's had a fall, prone to a lot of falls.
Sure.
Quite frail.
Yep. Thanks.
I'll introduce you to everyone.
Hi, how you going? I'm Matt.
So, Matt, this is Cal.
So when I look at Calvin, I can see that he is acutely unwell. He's making noises with his breathing, which indicate it's hurting him every time he actually takes a breath. And his skin is moving as he's actually breathing, which is an indication that he's got air trapped underneath his skin.
It says that Cal's had an unwitnessed fall at approximately 5 a.m, but was found a bit later by his wife. Has gone back to bed and been well, but then she said about 9 o'clock woke up complaining of that severe left-sided rib/abdominal pain. Quite short of breath. And just this really soft.
It looks like he's got surgical emphysema in his arm almost, I think.
That's what we said. It's sort of everywhere.
Surgical emphysema is where air escapes from the lung and then goes underneath the skin and starts tracking through various areas of the body. You're feeling inflated in your chest and in your arms and your neck and your face, and things are closing over, then obviously it would be very distressing for you.
All set in the back then. Take off brake for 05. Good to go, mate.
200 kilometres northwest, flight paramedic Steve and the air ambulance crew have been urgently dispatched to a road trauma incident on a country road.
A good RV point will be the Kingupna football ground.
Roger, received that, thank you.
We've been dispatched for a young man, a 19-year-old fella riding a motorbike. From what we believe, he's gone through a stop sign, but he's impacted with a car and has been thrown from the bike and landed heavily. He's got a severely fractured leg as his main injury at this point in time.
How far out are we? 5 minutes. Excellent.
Unfortunately, with just the way the roads are today, with a lot more cars, we are, as an ambulance service, seeing a lot more motorcycle accidents.
Right, we'll commence the descent. There's the oval. Very clear on the left. All right. Welcome to Governor.
G'day. Hey, how are you? Feel good. Hey, bud, how are you? Good. What's your name, mate?
Kevin.
Kevin? Kevin, I'm Steve.
I can see that the crews on scene that have picked him up from the actual accident site, they've treated what they could with regards to spinal immobilisation, pain relief and IV access, and also splinting of the limb.
What I'm going to do, Kev, I'm going to do a quick ultrasound on your tummy and just make sure you've got no bleeding around your pelvis or around your renal cavities. What do you do with yourself, man?
Look after my son mainly.
Your son, how old's your boy?
2.
How old are you, mate?
19.
Jeepers. Started early. Good work.
Already at 19, he's a father of a little 2-year-old, which is heartwarming to hear that. But it also adds a level of responsibility on my shoulders to think I really need to get this young man to hospital so he can go back and be what the most important role is, and that is father to his little one.
What are you doing riding motorbikes with a son, mate?
Because I was coming up to set up a camping spot.
Oh, were you?
A week.
Yeah.
Yeah.
And what happened today, mate? Just missed the intersection? Didn't see it, or?
No, I didn't see the stop sign on the intersection because I thought it was a railway.
Yeah.
And you'd go straight over. I didn't know that there was a stop sign.
There's going to be a little bit of pressure sort of pointing up in your tummy.
I'm concerned that if I do find some internal bleeding, he could continue to bleed to a point where we will actually require giving blood or administering blood.
Just take a nice big deep breath for me, mate.
So I really need to be thorough with my assessment because I only carry 4 units of blood and we're a long way from hospital.
Cal, hello mate, can you open your eyes for me? How are you feeling?
Lousy.
Lousy. We're going to organise some pain relief for you right now, Cal.
Back in town, Matt is assessing 85-year-old Cal, who appears to have broken his ribs.
It's there, is it? That's where the pain is? And there as well. Do you have pain in the back too? No? No worries. It's quite clear that he's in a lot of pain and discomfort. He's working hard with his breathing, and I can see that he's grunting with each respiration. We're just going to give you some pain relief up the nose, Cal.
All right, you just keep breathing normally. You don't have to sniff. Just breathe, that's it. We'll give you 4, help with the pain. That's it.
Sorry, it feels a bit funny.
Couple more, just keep breathing normally. Just until we get that needle in.
Watching on is wife of 61 years, Barbara, and their daughter, Liz.
Seeing him like that, he's breathing very bad and his face swelled up and in so much pain is very, very tough.
Cal's face wasn't swollen before?
It's very swollen, yeah.
Just from this morning?
Yeah, markedly different.
So just looking at him now, like he's broken a rib and some of the air in his lung is escaping underneath his skin, which is making it all bubbly and crackly. What did you actually land on, Cal? No worries. Sorry, Cal. You got little veins, Cal, and they're not doing much for me at the moment. He has a lot of air trapped underneath his skin, and his age and his pre-existing medical conditions means that his veins are actually quite brittle and hard to enter into. Sorry, Cal. We'll get one, mate. Don't worry. Okay, no worries. We've got a bit of Teagan. It is a relief to get your IV access. There's a lot more things I can do now that I've got a needle in his vein. Thank you. I can give him medicines for pain relief, and if I need to, if he deteriorates further, I can give him medicines which will allow me to take control of his ventilation as well. So it just makes the job go a lot more controlled and a lot calmer. So if we give 25 of IV fentanyl to be good, and then I'll just grab that lignocaine if I could.
His health has gone downhill since Christmas. Christmas Day we had a family party and he was good, but since then he has gone down quite rapidly, yes. We have 5 children 13 grandchildren and 2 great-grandchildren.
Although his vital signs, his heart rate and blood pressure and oxygen levels don't appear too bad, he's still working hard with his breathing.
Can I just get a 23 gauge needle and just a swab as well if I could, please?
One of the things that I can do is put a needle into his chest. So it's like creating a hole which is going to allow the air to come out of his chest and into the open air environment.
Cal, I need to put a little needle into your chest, okay? So if anyone's around, they need to stand back because this will cause a little bit of pressure and air to come out as I actually do this.
If the pressure is not being relieved from his chest, there is the potential that it will squeeze his lung and collapse his lung further and potentially squeeze his heart. So its ability to pump blood to the rest of the body is going to automatically reduce. Therefore, the long-term progression of that type of injury, and if not intervened with, is death.
Cal, bit of discomfort in your chest, okay, mate?
In country Victoria, Steve is finishing an ultrasound on 19-year-old motorcyclist Kevin, who was hit by a car after accidentally going through a stop sign.
So you can go here. Sorry, a little bit there. But you can see it's clearly, there's no fluid around there, which is good. And he doesn't have any heart rate or anything suggestive of a bleed.
So now that I've conducted a full assessment of Kevin and I've performed my ultrasound, I can't see any major hemorrhage. However, he could still have sustained a pelvic injury. And flying through the air and landing on the road. So just to be on the safe side, I'm applying a pelvic splint.
It's a bit uncomfortable. It'll sort of go over your hips. Have you got undies on or you're freeballing?
No, freeballing.
Freeballing? Kev, you're living life to the extreme, mate.
I live in life, yeah.
Living life.
With shorts.
There's ladies here, Kev.
Oh, no.
There's ladies.
There's ladies around.
Freeballing on a motorbike? Jeepers. It must be freezing. I think we'll just go over the shorts, actually.
Kevin doesn't have any underpants on. So for Kevin's sake, out of decency to him and to my fellow crew members, I decided to leave his shorts up and just apply the pelvic splint over the top, given the fact that Kevin's decided to go commando.
Just going to pass this underneath you. Don't you wiggle too much.
Yep.
Mate, you got no piercings downstairs?
I hope not.
You hope not?
Yeah.
You'd probably know about it, mate. So just a little bit of pressure around that pelvis, mate. To the side. There we go, popped. Just giving you a little bit more pain relief, mate.
Righto.
And we'll come straight out. Is there anyone that needs to know?
Dad knows.
Dad knows, yep. Where's he?
He was behind me. The car. Towing a camper trailer.
Oh, okay, yep.
So I saw the car hit Kevin and throw him away. My immediate thought was death. There was no movement. Could have been paralysed, it could have been anything. And I saw the mess of the car. I mean, the whole front of the car was wiped off, it's finished. Big hole in the windscreen where his head went through.
I know.
Well, I went to Kevin and he said, I can't get up, I've got a busted leg. So I had a look. Yeah, she was busted because the bone was sticking out through his skin.
I don't mind. I love it, bud. Okay.
I just realised what a close bond he must have with his father.
Thank you.
Because I can see Kevin becoming quite teary. So what I see is another side of Kevin at this point in time for a young fella who's just gone through something so traumatic that he has an understanding of the impact that this could have on others. And I think that's just such an amazing thing to see from a 19-year-old man.
He's a good man? You close with your dad?
Thought I was dead.
Oh, understandable, mate. Sounded like a big impact. I'm sure he's very happy to know that you're not.
All set in the back, mate. Okay, we'll lift off here with the middle of the oval and the departure will be to the northwest there, mate.
Kevin fits into a time-critical category because he's got long bone fractures.
150 feet.
There's potential there for circulation issues, and And on top of that, there's also potential there for nerve damage. So the quicker we can actually have it stabilised in hospital and assessed, the better outcome it can be. Because the worst case scenario, Kevin could actually lose his leg, and that would be just absolutely life-shattering for him.
Back in Melbourne,
Cal, bit of discomfort.
before Matt can make an incision into Kel's chest,
It's going to make all your skin go a little bit numb.
he gives him a local anaesthesia.
It may release a bit of air as I actually go into his skin.
As I push the needle into it, there's a big area of air and I'm getting lots of bubbles out, which is a clear indication that his lung has collapsed.
Okay, sharp coming out.
So the local analgesia makes all his skin become numb, so he's not going to feel any cuts or any needles into his chest. Then we need to make a small incision at that point that will allow the big needle that we use to get inside his chest cavity. There is a potential that you can hit major organs or major vessels inside the chest.
Cal, bit of a sharp sting in your chest. I've given you some medicine so it shouldn't hurt much. There we go.
Then we remove the sharp part of the needle and take that away, and the plastic hub stays inside the chest cavity.
Sharp coming out.
So there's a little one-way valve in a plastic clear cylinder at the end of the tube. So when we look for a sign that the needle has done the right thing, we'll see a fluttering within that valve inside the clear plastic tube.
You can see that fluttering slightly there. When he takes a breath, it can.
We're letting the air out, allowing his lung to re-expand. But by doing that, we're not going to get rid of the surgical emphysema. He doesn't automatically deflate like a balloon type thing. For the rest of his body, it's going to take a while to dissipate.
Much better. So looking at our numbers, they're still good. Cal, how are you feeling?
I was surprised at the work that they had to do whilst he was still sitting in the chair. They obviously had to stabilise him a little bit, and that was a bit distressing to see all of that. Mum and Dad have never been apart. They're each other's soulmates.
I'm going to disconnect you from the monitor for the moment, Cal, and we're going to wheel you and pop you in the back of the ambulance, okay?
Where the patient is acutely unwell, my attention gets focused on the patient, but I know that my team will be looking after the family members and friends and ensuring that they are taken care of as well.
Turn towards me. I've got you.
This way, just a step, that's it. A little dance. You good?
Although Kelvin is actually feeling better at this point, it's clear that he's still got a significant injury. Obviously broken ribs, but I don't know what else is going on, so it's important that we move him rather quickly to hospital.
Calvin, we're taking you to the Alfred Hospital, okay?
While Cal has been stabilised,
All right, let's get moving.
Matt needs to stay vigilant for the 40-minute drive to the major trauma centre at the Alfred.
Are you right, Cal?
If I'm concerned that his oxygen levels start to go low again, I can do another needle decompression in the same spot. Or if he continues to deteriorate and drop his blood pressure, then I could end up taking over his breathing by putting the tube into his throat and controlling his breathing that way.
"19-year-old Kevin is being flown to Melbourne with a badly fractured leg.
Hey, Kev, you can hear me, bud? You don't have any other pains anywhere, mate? Chest feels okay? Okay, awesome, mate. You don't feel sick in the tummy? No. All right, mate. We'll give you more pain relief.
So now that we're airborne with Kevin, our job doesn't stop. We're always constantly watching any changes in the trends of his heart rate or his blood pressure. If he has a decreasing blood pressure and an increasing heart rate, I'm going to suspect that there's some bleeding that's now active or taking place internally. So we're always just watching that monitor and we're looking out for any signs or any changes.
How's my leg look?
Oh, look, mate, at the moment the colour's good. You know, the toes look fine. Looks like you're getting good circulation to it.
Yep.
But where the actual fracture is, mate, it's all bandaged up. So it just depends how complicated the fracture is, if any bones missing or whatnot, as to whether or not you need surgery or just plaster. I don't know, mate, that's up to the specialist down there. But,
Easy enough.
But it's still attached, mate. It still looks like it's got good colour.
Yeah.
So that's amazing.
Easy, thank
Cool,
you.
mate.
Righto.
Only about 2-3 minutes, yeah?
Yeah.
Like any job that we do on HEMS, it's always a relief when the hospital is in sight, especially coming from rural areas. We're in the air, we don't have the availability just to stop on the side of the road. And in Kevin's situation, I'm really comfortable to see that he's actually travelled very, very well, despite the fact that he's still got pain with his leg. He hasn't shown any signs of any hemorrhaging, which is a huge relief.
It's 380.
The Royal Melbourne Hospital, Kevin's going to be met with a trauma team and they'll conduct their own assessment just like I conducted mine. And based on what they find, he'll either go for scans or he'll be sent off for surgery with the orthopaedics team in an attempt to fix his leg.
Good work, boys.
I really hope that Kevin gets to go camping with his son and his dad.
And when he does head out for that camping trip, some sage advice.
So Kevin, it pretty much dates back to what my mum always said, make sure you got clean underwear when you go out. He would never have thought this was going to happen, and he would never have thought he was going to have a paramedic standing over him, lecturing him about wearing underpants.
How you going, Calvin? All right? Good man.
Despite saying otherwise, Matt knows his 85-year-old patient, Cal, is in a lot of pain with fractured ribs and a punctured lung.
Calvin, I'm just going to give you a sting on the end of your finger and I'm just going to check your blood sugar level. You've pretty much had everything done to you today, haven't you?
Dad's a lot of fun, very cheeky. I do remember him just trying to make us laugh all the time.
So SAT's good, end-tidal's good, blood pressure's good, heart rate's good. What a day out for you, Calvin.
I think Cal is a tough man. I imagine that the level of discomfort he has experienced over the last 3 or 4 hours that he's had this injury is intense, and he's sitting there tolerating all of this very, very well.
You all right there, Calvin? You okay?
Unfortunately, our roads are not beautifully smooth all the way to hospital, and you can have lots of pain relief on board, but if you've got broken ribs, every time you hit one of those bumps, you're going to feel it. So he's a very strong man and he's putting up with an awful lot.
What have you missed out on for the weekend? No birthday parties to go to? Yours is coming up soon, isn't it? So a couple more weeks, it's your birthday. No. Just a bit of cake for the birthday would be all right, wouldn't it? Nice bit of cake. Calvin, we're on Punt Road at the moment, and we're about to turn into the Alfred Hospital, okay? Not too much longer. You've done really well.
I can see that Calvin is a lovely man, surrounded by a lovely family, and my hope is that the hospital will look after him, give him lots of pain relief, keep him comfortable so that he gets home to his family.
Thank you.
On the other side of Melbourne, paramedics and good friends Taz and Erica have just been called to a suspected drug overdose.
It says call taker can hear patient crying, and she said her head hurts. She had heroin 10 minutes ago.
Oh, there you go.
So if it is an overdose, seeing safety is always number one for these types of jobs, isn't it?
Yeah.
So if she has had some heroin and she's drowsy and having some breathing issues, we can look at giving some Narcan. We'll just see how she's responding to us. Yeah. We'll just be very careful and just looking out for any sharps and uncapped needles, that sort of stuff. Yeah, exactly.
We never quite know what we're going to be walking into, and there's always a risk of potential violence and unpredictability in these cases. So we do have to be really vigilant, because if we become hurt or injured, then we're unable to help other people.
So we just keep our wits about us.
Are you with her?
We pull into the street and we can see a man and a woman. The woman is stumbling down the road and she's clearly drug affected.
Did she go unconscious at all at any stage? But she's been like this for the whole time. Yeah, she's not safe.
Watching this woman stumble across the road is a disaster waiting to happen.
Has she taken some heroin? Yeah. Like how much?
Quarter of a 50.
Yeah. How long ago? Okay.
With their patient wandering off down the road, Taz and Erica must work out how to approach this case.
She clearly looks drug affected. Although she's conscious and she's standing and walking, but she's stumbling all across the road, she can fall and hit her head, and she can be hit by a car. She can also go unconscious and go into respiratory arrest, stop breathing.
Yeah, she's walking on the road.
Hang on. I'll get her.
Okay.
I'll take it to her. I don't know what else to do.
The thing is that we don't want her to keep wandering on the road.
I'll get a car and I'll take it to her.
Yeah, will you be okay?
Yeah.
Because we still want to assess her. We still want to see if we can help her.
Yeah.
Because she may be okay now. I mean, walk in the sense she's probably walking, but she may go unconscious at any stage. Yeah.
Oh, she's real agitated.
Yeah. So let's have the doors locked. You okay? He's concerned about you.
No.
Where are you heading?
I'm just down here.
Does someone live here?
Yeah.
Who is that someone?
No.
Can we see that you go okay? Is that okay? You walk and we'll follow you.
As much as we want to help this patient, we cannot force people in the back of the ambulance, but I'm still concerned for her and I just want her to be safe.
So very unpredictable patients.
Yeah, they are, aren't they?
I think my only thing is she reaches the home safely.
Yeah.
That's the only thing.
Yeah, of course. Yeah, the other fella's with her. Like, I'm happy.
I guess we can take a level of comfort in the fact that we know she is going to somebody's house who can be there to observe her when she is in this drug-affected state, so that if something does go wrong, if she does lose consciousness or if she does stop breathing, there is somebody else there who would then be able to call 000 to call us back so we can come and intervene.
The patient and the man have arrived at their mate's home and disappear down the driveway.
RC139.
For now, we know that this woman is off the road, she's safe inside a house, there's someone looking over her, so now we can clear and make ourselves available for the next person who needs our help.
That was interesting, Taz.
It was very interesting.
Yeah.
There's often people judge for their lifestyle.
Yeah,
you know?
Yeah,
like,
definitely.
Or drugs or alcohol, there has to be a reason, no one wants to do this.
No.
We don't judge for people for
Not at all.
What lifestyle they choose.
Not at all.
Emergency services. Okay, tell me exactly what's happened.
Just picked up my 7-year-old after school care. She's just in her bed and I can't wake her up.
Did you say you're unable to wake her up?
Yes.
Okay, I'm organising that help now. Stay on the line. I'll tell you exactly what to do next.
Chief, we've been dispatched to a 7-year-old girl who's unconscious, unable to wake up.
The traffic in the northwest tonight is unusually heavy, and father and daughter, Brett and Teagan, have some distance to cover.
I'm thinking of my kids when they were 7 to 10-year-old, and you put yourself in that same situation. As a parent, it would be just gut-wrenching. They'd have a squillion questions, and we're out in traffic.
Good, clear left. Yep, well done. It's okay, so just going to read it up again. Fast breathing, colour change pale.
Teagan's driving and doing a fantastic job. Safety is our paramount, and obviously the other stakeholders on the road, so we don't want to be causing other accidents, so we've got to try and be fast and smooth.
We're trained to drive in these situations. It's just all about controlling your emotions.
Another quiet night is going horribly wrong. This time for an elderly man out for dinner with his family.
Emergency services, tell me exactly what happened.
My husband It seems to be passing out. He's semi-conscious.
Okay, we'll get some help for him. How old is he?
82.
Okay. Does he have a history of heart problems?
He has a pacemaker.
Okay. Got that help organised, okay?
RC139, Roger, code 1.
Mike and Eamon are being sent to support MICA paramedic Gavin, who will get to the patient first.
We're going to a 82-year-old male who is at a pizza restaurant who's passing out. He does have a pacemaker.
If a person's pacemaker is not working correctly, it means their heart's not going to be beating the way that we need it to, and it can lead to problems like collapse or even a cardiac arrest.
All right, not clear on the left, can't see anything. Okay, lane 1 stopped, lane 2 clear, clear left.
When a person collapses, that usually means there's not enough blood going to their brain. That's really serious on its own, but especially in an 82-year-old person, it's not a great situation.
There they are up there. Evening, has our colleague come through here?
When we arrive on scene, our patient's already been placed on the ground. He looks really frail and really unwell. His skin colour is quite poor.
What's your name, sir?
John.
John, g'day, John.
He could be in big trouble.
It's the dispatch paramedics dread as father and daughter Teagan and Brett race to the home of a 7-year-old child found unconscious in bed by her mum.
I wonder if she's got any respiratory problems, asthma or anything like that. Bit of an unknown. Anaphylactic to something.
Should have like a congenital heart condition.
Yeah, I suppose so, yeah.
You can imagine the minutes would seem like hours to the parents waiting for us to get there.
You have to just sort of keep mum and dad calm. If we keep them calm, things should be better, but they'll be pretty upset to have their child non-responsive. When you have kids of your own, it can be quite emotional.
Yeah. It's a pretty big driveway.
It is, yeah, it is.
A single responder paramedic is already inside.
Hello. Now on the left. Hello. I'm Brett. This is Teagan. Hi, how are you?
Yeah. Bella.
Hi, Bella.
When we enter the room, I see patient sitting up talking to the paramedic that's in there. But according to Mum, she was unconscious not so long ago. So we still need to do a full checkup on her.
It sounds like she'd run herself into bed. Okay. And Mum's coming to check on her and tried to see how she was going, and she was quite drowsy or unresponsive at that point.
So Jarrah, the single responder paramedic, tells us that he's already done a COVID test and that's come back negative. So that's a relief.
So what I'd like to do is have a look at your throat up here, and your ribs and your tummy, and see how your breathing looks. I know it's cold, so we'll just do it quickly and then you can wrap up again.
Would we be able to have a look at that, Bella?
Yeah, Bella?
Lovely. Look at you go. I can see what you had for dinner. Good girl.
Dad's really good at getting kids to trust him, and I can speak from experience. He's got hundreds of dad jokes, which work every time.
So you have got long hair. I see it's grown a hair clip. A pretty pink one. Excellent. Very clear, yeah.
Bella's breathing is fantastic. There's no sounds that I shouldn't be hearing.
So probably the big thing is that she's febrile at 38 degrees, which is quite warm. Heart rate's 130, a little bit quick. Blood pressure's on the 100, so that's perfect. And the oxygen sat stills at 97%, so that's brilliant. Yeah. So everything that I would see is quite normal for Bella. How's she looking for you right now? Is there any?
Tired.
Just tired, yeah. Yeah.
Thankfully, Bella doesn't have anything life-threatening, but she does have a temperature and complaining of a sore throat, so we will give her some Panadol and see how she goes. Mum tells us Bella doesn't like taking pills, but luckily Dad has totally gained her trust.
Okay, sweetie, we'll take our tablets. Here you go. Here's your water. Go on, sweetie. That.
What does it taste like? Strawberries or something?
Lemon. Right.
Ooh.
she agreed to have some Panadol. And that was to Mum's amazement.
Oh, yum.
You're doing so well.
So we've had a chat with Mum now. She's happy that Bella's back to her normal self. She's getting better by the second, actually, and she's more than happy for Bella to stay with her this evening.
Okay. So, no trip in the ambulance for Bella tonight, but Brett's happy to give her a tour before they go.
There you go. Where would you like to sit? On here? You be the patient.
What do you think that looks like?
Ah, yes!
That's what it's supposed to be.
Good girl.
What do you reckon?
I really do love working with Dad, and it's been so great to see how he is with patients, especially the little ones.
See you, Possum. Bye-bye. Well, she was a nice little girl, wasn't she?
She was gorgeous.
She was lovely, yeah. She loved your bloody elephant.
Oh.
Hey, I haven't seen that before. Uh-oh.
Oh, it's not my best one yet. Just the eyebrows were a little bit off today.
Mike and Eamon are supporting MICA paramedic Gavin to treat a man who passed out at a pizza restaurant.
He's not been feeling well for a couple of days.
Yeah.
John's had a kidney removed 20 years ago.
Sure.
And his other kidney is in a degree of failure. It's on the way out. Blood pressure about 70, he's sitting at the table. So I've laid him on the floor. I set him up for some fluid. I wanted to ascertain firstly whether he can still excrete fluid.
In order to fix John's blood pressure, we want to give a small amount of fluid into the vein. That'll mean there's extra blood going back to the heart and it's pumping more effectively, which will increase his blood pressure.
What he did tell me was that they've changed his diuretics recently.
Sure.
So it's quite possible.
Might be the culprit.
Have you been for a wee a lot today?
Yes.
Yeah. So you may have excreted a little bit too much fluid and that's made you susceptible to
I wouldn't be
low
surprised.
blood pressure.
Okay.
We have to be really cautious when giving John fluid because he's only got the one kidney and even that's starting to deteriorate. One of the problems if we give too much fluid is that he's not going to be able to wee that out because his kidney's not working correctly. That can lead to problems like blood backing up and fluid entering the lungs, which can be quite dangerous.
You like me to organise extrication or a bag of fluids?
Let's get a bed. He's going somewhere, so we'll leave you on the deck for a little bit. And when we get to bed, I might get you to sit up on the stretcher.
Yeah, we'll help you up.
Anytime we're giving a patient like John fluid, we have to monitor them carefully. We give a little bit of fluid and then we measure their vital signs again. And we continue this process until we're happy that his body is in a stable state for transport.
So what's going to happen, John? We're going to assist you to just stand up and sit on the bed. We don't want to work you too hard.
Just push the bed in behind him. Ready, set, go.
Yeah, straight there, that's it.
Bravo, sir.
And you can lie your head back. 92 on 60.
Okay.
102.
92.
92?
Yeah.
John's blood pressure has come up to the low 90s, which, although it's improved, is still not a good number.
So we'll give you a little bit of fluid. We want to be careful because of the one kidney. That's not too good.
By giving some fluid to John, I'm going to be able to prop up his blood pressure temporarily. But because the cause is still unknown, it's important we get him to the hospital quickly so he can be assessed and have that cause definitively fixed.
Oh, now this is most important. You have to give him a big smooch.
Oh, yeah. There you go.
Behave yourself.
Look at him go.
Excellent.
Do you want to give him one as well?
I'll give him a whack and he's just really like
No problem.
You're
You'll be
most
all
welcome.
right.
Thank you.
It wasn't the food. No.
Even though John's collapsed inside the restaurant, it's not the restaurant's fault. So it's important to do a little bit of PR work as we're getting John into the ambulance.
Oh, it does smell good even through this mask. Did you get to have your dinner, John?
Did I get any dinner?
Yeah.
No.
Oh, we'll have to get him to put it in a takeaway for you.
"19-year-old motorbike rider Kevin was hit by a car at speed on a country road after accidentally running a stop sign. At hospital, doctors confirmed Kevin had a nasty compound leg fracture. Surgeons had to dislocate his knee to put rods permanently through his tibia. Kevin spent 3 months in a moon boot.
Now, if I order some more wood to move all this.
Yep.
But he's now getting around nearly as good as new.
Don't know why that's not opening.
He had a broken finger, broken leg, but he was all right. That one there, it's got a dipstick in the transmission there. To the paramedics, all I can say is thanks muchly.
Yeah.
He returned back good. They do their job every day, see these sorts of things every day. They have to be a kind of special sort of person and a very strong sort of person.
Oh, well, we haven't got much to do until we take this out.
Well, pull the boat out.
Easy.
It was a day that neither Kevin or his dad will ever forget.
Should have saw that stop sign. I knew Dad was behind me and, well, I was a little bit concerned for what he just saw. Yeah.
He's my son. I'm his dad.
Blood pressure about 70, sitting at the table. So I laid him on the floor.
Mike and Eamon were called to a pizza shop after 82-year-old John passed out with drastically low blood pressure.
So what's going to happen, John? We're going to assist you to just stand up and sit on the bed. We don't want to work you too hard.
At hospital, it was confirmed John had volatile blood pressure, and because of his pacemaker and renal complications, it took doctors 2 days to work through a delicate balance of competing medications to stabilise him.
Sorry, Cal.
When the paramedics arrived, 85-year-old Cal was in a lot of pain and struggling to breathe after a nasty fall in the bathroom.
What a day out for you, Calvin.
At hospital, it was confirmed Cal had fractured 5 ribs, puncturing his lung. He was given further pain relief and sedated.
I still remember that day. Thank you. He looks very happy there. Yeah. Yeah.
Cal was already frail from emphysema and lung cancer. He never regained full consciousness and passed away 2 days later, surrounded by his family.
He had a good life. His family came first above everything else, yes.
Pop was handsome, wasn't he?
There were so many angels watching over Dad on that day, and those angels were the paramedics that came to support him. Beautiful, wonderful people looking after a very frail man.
Yeah.